approached by Dr. Mohammed along with Cancer Alliance to be involved in the colon capsule clinics, not only with the clinic side of running the day-to-day service, but also the reading of the colon capsule. The pill cam is a capsule size of a multivitamin tablet with a camera either side, and we watch it both ways so that we don't miss anything when viewing the video. So the patient arrives into clinic, they come into the clinic room, we go through everything, make sure they understand what they have agreed to. We go through the pathway with them and go through the consent form. Once that has happened, they swallow a medication called prucalopride, 1 milligram. They take that 45 minutes to an hour before they ingest the capsule itself. We go through the alert guide with them to explain when to take other medications that they need to take home with them, called gastrographin. We then attach the equipment, which entails a belt and a recorder. Once that is all attached, we then give them some water with a little bit of Infocol, which is like a bubble disperser. A lot of parents give it to babies. That just means that we get really good images, just to stop any bubbles creating issues with the camera. We let them take the capsule out. It flashes quite brightly, and then they swallow it like they would normally any tablet that they take every morning or night.
I really wasn't looking forward to having a regular endoscopy. You really do have to psych yourself up for it. It's not just the preparation that can be a little bit intrusive and inconvenient. It's also the being on a table, lying down and having a camera basically thrust upon you that is quite daunting. The relief I felt when I had the letter from the hospital that said I was going to be able to swallow a small camera, it was not inconsiderable, and I think that it's the way forward. Usually there's a long wait for endoscopy. This seemed to be a quick way of getting the same results with less invasion. It was refreshing, shall we say, refreshing option. And hopefully it'll be made more widely available. Well, surprisingly, I found it just as easy to swallow as a large vitamin pill. It went down very easily, and I was given a drink of water to do so, and I didn't feel a thing. I feel confident what to do when the device gives an alert, because it's quite clear on the sheet of paper that I've been given, and I understand also that if I do need any assistance, there's a phone number for me to ring.
The capsule clinic, as well as endoscopy, will come hand in hand. We can use the capsule as a diagnostic procedure, especially at the moment with patients who are known to have had polyps removed in the past. We can use this capsule to quickly have a look to see if this patient has created any more polyps within the time frame that was set for them for surveillance. With the camera on both ends and the way the capsule passes through the tube-like shape of a large bowel, we're able to get very good images of the large bowel, looking for polyps and any abnormalities. It's nice to be able to give our patients options. We do have some patients who find colonoscopy especially quite painful or uncomfortable, and with this new capsule service we're able to give them that option to have a look for any polyps that have formed since their last colonoscopy and see if any have grown since then. If the patient has polyps, which we see on capsule, it will mean that they will have to have a colonoscopy at some point in which to remove them, but at least we know then that we're going to do the colonoscopy for a reason, and that we'll be able to plan for their future after that procedure.